Hi, my name is Mario Sierra. I'm the founder and CEO of Biosciences, and we're based in Austin, Texas. It really did come from the journey that, number one, my mom came from. So I'm a miracle baby. My mom had endometriosis and was told she would never conceive, and went through a very rough fertility journey to conceive my sister, older sister, and then I came afterwards. But I really got to see it firsthand with my sister, where she had to go from doctor to doctor and try and advocate for herself and get the same test done over and over. And I thought there had to be a better way. So leveraging my background as a biochemist and a clinical researcher in medical devices, I saw that there was an opportunity to bring a continuous hormone monitoring device to market, and so that was the impetus. We know that fertility rates are declining across the world. If you look at how they do treatments now, it's a lot of point-in-time tests. So you get a blood test and then you get a result. I think what's missing in this in the arena is continuous data, really getting those insights and the trends and understanding of how your hormones are fluctuating, so that we can personalize treatment and become proactive as opposed to reactive. I always compare it to the glucose monitors that are out there on the market right now. So it's a wearable that you put on the back of your arm. There's little micro needles that are a millimeter in length, so you really don't even feel them, and it's continuously measuring. So what's nice about it is that the current solutions on the market they're pretty cumbersome for the patient. You have to do a lot of, whether they're at-home saliva tests, urine tests, you have to do a lot of manipulation of the devices themselves. Ours is you just simply put it on and it starts measuring. And then there's a companion app for the patient, so they get direct insights, hormones, the number, concentration, and then trends over time. And their physician can also remotely monitor them and give them better treatment. What I love about startups is that it feels like organizing chaos. My background is in scaling startups, so jumping in when there's not a lot of organization, not a lot of procedures, and figuring out what to do from point A to point Z. So that to me is really motivating, and at the end of the day, with the company and the device that we're bringing to market, we're impacting health and impacting lives. And also the goal is to have babies from the fertility journey that women are going on. So obviously that's something very tangible and something that brings joy into people's lives. So that's very motivating. I'm born and raised in Texas. I grew up in Houston, went to school in Austin. Dallas is not an ecosystem that I was really tapped into. So that was really enticing about the Health Wildcatters program being based here in Dallas. Having gone through the accelerator now, I can definitely say that we're tapped into this market. When I first came to Pegasus Park and seeing just the industry that's being built here and the innovation that's happening, and then specifically coming to the Health Wildcatters floor and seeing all the companies that were on the wall, I really envisioned us being here and walked down that path to make our company part of this program. And now we're exiting it, definitely accelerated and super excited to jump into the market. At the end of the day, I don't think we're building just another wearable. I think we're building a window into human biology. So what I'm most bullish about in the next 5 to 10 years is actually the data set. So the device itself is going to be technically challenging to bring to market, but at the end of the day, the data set is where a lot of value is going to come from. There's going to be tons of learnings that we can do, from biomarker discovery to personalizing medicine and becoming a proactive solution, and really stepping in and being a proactive solution and changing the paradigm from reactive medicine to proactive and personalized medicine. Texas is not normally seen as a biotech hub. When you think of biotech, you probably think of either Boston or Silicon Valley. With the company that we're creating and the resources that we have tapped into here, Texas is going to be on the map. And so I'm really excited to be one of the contributing companies to that and getting Texas into the biotech innovation sphere.